Okay, I'm going to continue my assessment with the tongue. That's where we were left off in the other video that got cut off. Okay, so I have my tongue depressor over here. With this, I'm going to depress the tongue and I'm going to be able to see the uvula, okay? I have my glove. And I have my pen light. Okay, Miss Reina, open your mouth so I can assess your hard palate. No, it's okay. Okay, perfect. I see the uvula is midline. I don't see any redness, no swelling. Okay, perfect. Okay, let me see the mucosa. I see the hard palate. Can you touch your the tip of your tongue with the perfect? I see no lacerations, no swelling, no edema. Okay, I'm gonna assess your teeth and your gums. Okay, I don't see no discomfort. Good dental hygiene. Okay, the papillae are appropriate to no swelling, and I don't see no white patches, no nothing in her throat, so this is an appropriate finding. And I'm gonna go ahead and let me ask you, can you say ah? Okay, assess cranial nerve number 9 and 10. Okay, so this is a hypoglossal nerve. After I go ahead and assess hypoglossal nerve, I think that will conclude my assessment for the throat. Okay, now I'm gonna go ahead and assess the musculoskeletal joints. Okay, for this assessment, I'm gonna use my gonometer. Okay, can you stand up, Miss Reina? Okay, I see her straight posture, appropriate gait. I'm gonna assess your spine. Okay, I see concave over here in the lumbar part of the spine and in the cervical also. The thoracic part is convex. Okay, can you bend forward? Perfect. I don't see no scoliosis, no deformity. Okay, scapula is straight line. Perfect. Okay, you may stand up. No abnormality noticed, no kyphosis, no scoliosis noted. Okay. Okay, can you now that you're standing up, let me assess the range of motion of your hip. Can you twist yourself left and right? And can you bend to the right and to the left? Perfect. I don't see no limitation. No crepitus sound heard. Do you feel any pain when you did this?
No.
Perfect. Any tenderness?
No.
Okay, you may go ahead and have a sit. Okay, so in this assessment, I'm going to assess the mobility of the shoulders. While you're sitting over there, I'm going to make sure that you don't have any swelling. Okay, I'm going to go ahead and assess the upper extremity first, which are the shoulders. Do you feel any pain when I touch this?
No.
Any pain in the elbow?
No.
I'm going to assess her wrist. Any pain?
No.
No tenderness, just warm to touch. I'm going to assess her fingers, her hand. Any pain?
No.
Perfect. I'm going to do it bilaterally. Do you feel any pain over here?
No.
Okay, I don't see any swelling, no redness, no deformity noted in the shoulder. Okay, I'm going to assess her elbow. Okay, no swelling, no deformity. Do you feel any pain?
Okay.
Okay, I'm going to go ahead and assess her wrist. Okay, no pain?
No.
No deformity noted, no swelling, no crepitus sound. Okay, now I'm going to assess for range of motion of the upper extremity. Okay, stand up, Miss Marina. Okay, I need you to do some exercise. Put your hands straight forward. I'm gonna measure with my gonometer. Okay, perfect. Okay, good. Now, can you bend your shoulder all the way to your chest? So I can assess the range of motion. Great. Let me do it. See in the other one. Okay, bilaterally range of motion in both arms. Okay. Perfect. Can you put your hands like this? Touch with the tip of your finger your shoulders. Good. Now I'm going to assess for strength, okay? Find the opposite. Perfect. Okay. Now I'm going to go ahead. Can you put your arms straight forward? Okay, I'm going to measure the angle. Great. Let me do it bilaterally. Okay, angle is appropriate. Normal range. Okay, now I'm going to assess for strength. Bend your arms backwards again and find the opposite resistance. Great. Alrighty then, now move your hand forward and flip your hands upward and downward. Great. Open and close your hand. Perfect. No limitation of movement, no crepitus. Now I'm gonna assess for strength, okay? Try the opposite direction. Perfect. I'm assessing the resistance of the elbow. Now I'm gonna assess resistance for the fingers, okay? Now put it like this and find my right. And now put it back. Perfect. Good resistance. Notice in the finger, in the hand. Now with your fingers, I'm gonna put some pressure right over you. Right. Perfect. Good resistance. Okay, you may go ahead and lower your arms. I already assessed the shoulder, the elbow for resistance, and I also assessed the finger and the wrist. Okay. Now I'm gonna go ahead and assess your knees. If you may have a sit, I'm gonna assess the lower extremity, which are the hips, the knees, the ankles, and the feet. So for this assessment, I'm gonna make sure that she doesn't have any swelling. Let me know if you have any pain, okay? I'm gonna touch you. Okay, no deformity noted. No swelling. Okay. I don't see do you feel any tenderness?
No.
It is warm to touch. Okay. I don't see any bruises. Okay, you may go ahead and sit flat and lay back. Okay, for this assessment, I'm going to assess the range of motion of your hips. Can you put upward your right leg? Good. And the left leg? Perfect. Good range of motion. Now, can you put your knees away for the midline, the right one? Great. Now, can you put it towards the midline? Good. And now, can you put the right, yeah, towards your chest, all the way to your chest? Good. Now, I'm going to assess your right leg for resistance. Put it back to your chest. Okay, I'm going to find good resistance. Now, we're going to go ahead and do the same thing with the left leg. Okay, perfect. I'm going to check for resistance, good resistance. Now, put your knee towards the midline. Now, away from the midline. And now, if you can, let me see. Perfect. Okay, you can put your leg down. Now, I'm going to check resistance in your knees. Please try to move your legs away from midline. Good resistance. Try to move your hips upward. Good. Good resistance. Now I'm going to go ahead and check your ankles and your toes. Can you dorsiflex and plantar flex for me? Good. Good. Okay, I'm going to check for resistance. Dorsiflex. Good. Plantar flex. Good. Alrighty then. So now that we checked the knees, the ankles, and the toes, can you put your toes upward and perfect? I see good range of motion. Now, Ms. Reina, can you flip in your abdomen so I can check range of motion in your back? Good. Alrighty. If you can raise your right leg, good. I'm gonna check for resistance. Good resistance. Left leg. Good resistance. Okay. Do you feel any pain at this moment?
No.
Okay. Any tenderness?
No.
Okay, as the patient moves, I see the range of motion, it is appropriate. I don't see no limitations, no redness, no bruising, and no swelling. So this will be an appropriate finding. I will document this as an appropriate finding. And let me see, we already assessed your TMJ. We assessed your ears, your nose, your mouth, the contour of your head. We assessed the musculoskeletal. We assessed the throat, and we assessed the thyroid. Also, we already assessed the upper and lower extremity for the joints. And I think this will conclude our assessment. Okay, Ms. Brenda?
Thank you very much.
Thank you very much. Have a good luck in your class, okay?
Thank you.
Okay, bye-bye.
Bye.